Whooping cough, also known as pertussis, is spreading across Arizona. Cases are at their highest level since 2013, according to data from the State Department of Health Services, which reports 591 cases as of mid-November. Joining us now to talk more about this is Dr. Frank LoVecchio from Valleywise Health. Good to see you again.
Good to see you.
Before we get too far in this, what is whooping cough?
Whooping cough is an infectious disease caused by pertussis, which is a bacteria. You're vaccinated against it when you're a little kid. You get about 4 or 5 vaccines when you're a kid. You get a booster when you're about 11, 12, and then it kind of wears off, and that's why you sometimes get it as an adult. Little kids that don't get it, sometimes they can die from it. So kids that don't get vaccinated from it can die. Adults that get it can get really bad pneumonia, sometimes even meningitis, but the most common thing is a very, very bad cough. They call it whooping cough because you make a whooping sound.
Yeah, it basically, especially for little kids, it's hard to breathe, right? That's where that whooping comes from.
Yeah, and when they're not, if they get it, it's very, very hard to treat that cough. We try antibiotics, but it's usually a long process, sometimes like a month long, to get rid of that cough.
How long after exposure do symptoms appear?
Usually within about 2 weeks or so. And as you said earlier, this year has been so much. It's been double the amount of cases that we usually expect by this time.
Is it difficult to diagnose?
Somewhat. You have to do a special culture. Usually it's a godsend when the patient comes in and gives that characteristic cough that sounds like a barking. And it's been going on for a while, so then you kind of know it's that.
And as far as the symptoms themselves, do they differ kid to kid? I mean, are they? You say that the cough is almost always there, though, that whoop.
Yes, that whoop, when it's there, it's classic, but it starts off as a slower cough. It can start as, pneumonia. And the little babies sometimes, unfortunately, get apneic or stop breathing. So that's a little difficulty when they're under 1 year of age.
Okay, and treatment is antibiotics. How contagious is this?
Very contagious, but you're protected if you are vaccinated. And as an adult, sometimes we don't get a booster for pertussis, but if you get a tetanus shot, that usually has pertussis in it. Okay?
Oh, interesting.
So DTP, you want to get the P part. You want to make sure that the tetanus has the P part in it.
Because as adults, as you mentioned, they call it like the 100-day cough or something like that.
That's right, the 100-day cough.
100-day cough. Yeah.
You don't want to cough for 100 days.
No, you don't want that. You don't want that. And there is a vaccine, and 5 doses recommended for the little folks. And
they have to get it before they go into school, unless there's special circumstances. But then, as an adult, when you get your tetanus shot, which you should get every 10 years or so, you'll get a pertussis shot too.
Why the increase here? What's going on?
Well, there's a lot of theories, but obviously the biggest one is that people aren't getting vaccinated as much. In our state, they're not getting vaccinated as much as the surrounding states or other states.
And I would imagine with COVID, social distancing and the masking and all that stuff, you probably had quite the dip there for a few years.
That's right. And so now they think it's catching up. But last year was like half as many cases at this time.
Yeah.
Doesn't quite explain it all.
So, just vaccination, you think, is a major part of this, huh?
Yeah, vaccinate. If you're sick, stay away from people, like almost all respiratory diseases.
Okay. Is this happening only in Arizona, or are the cases rising around the country?
Arizona's endemic for it. And we were number one with the new cases in the country. We're number one for a lot of bad things, and that's one of them.
Wow. Why is that? Other places, there are vaccine skeptics all around the country.
Yeah, there's a little bit of proximity with us. Maybe there's some get-togethers that we got a little bit earlier. You have to always think what happened 3 weeks before, and that's probably what was happening.
Interesting. Okay. The most important thing to know about pertussis is?
The most important thing to know is that little babies can die. Vaccine is the single best protection, and you can get care. We can give you antibiotics because it can get a little more serious, go to your lungs or go to your brain.
All right. Go to that. That sounds very bad. The flu. What are we seeing? Now that we got you here, I want to ask about the flu. What are we seeing out there?
This has been an amazing peak with the flu. So good for the flu, bad for patients. It's been 200% higher cases that we've had this year compared to last year. So we see that recurrent theme. Maybe it's people getting together, maybe it's COVID catching up. But again, people aren't getting vaccinated as much for the flu, and I admit that the flu vaccine this year was not great. It only hit about 35%. When it hits 50% or more, covering 50% of the viruses that are circulating, we're ecstatic. This year was only 35% or so.
When you say this year, do you mean the flu season back in the winter and back in the early part of the year, or you mean the season coming up here?
The season coming up. So when you get vaccinated, it's still a vaccine for the flu. It's the single best thing to prevent the flu, obviously, and not being exposed to people who have it. But we try to predict what's going on in the southern hemisphere, like Australia, and we say, which flu is going crazy down there? This variant, H1N1. Well, let's put it in our vaccine. But we're always 3 or 4 months behind. Then it gets released. Okay, and then what happened 3 or 4 months ago, we're stuck with because
Yeah.
it's on, it's in the vial that they're giving it to you. So we can't get it right all the time. We have to get better technology to kind of only be a month behind instead of 3 months behind.
If it winds up being really different and almost just not even worth it, is there a way to get an updated flu vaccine later in the year or early next year?
That's right. They did that one time. I think the H1N1 or H3N3 outbreak, and there was a mandate. So it takes a mandate from the government
Wow.
to say we can produce this, and you can get it done in about a month.
You can't? Okay, all right. Well, that's relatively encouraging. But in Arizona, it seems to me, and this is just experience, it seems like the flu season is a little later here, usually. Is that what we're seeing right now?
Just the opposite. We're seeing it so early, which is so surprising. We have seen bimodal peaks. So usually you get a peak sometimes around Christmas or the New Year. This year seems to have started early, and we hope that people get it and then it's over.
Yeah. You could get a double dip, though, couldn't we?
That's
later
right.
in the
That's
year.
right. The double dip is what we worried about.
Yeah. All right.
Double
Well,
peak.
great information, Doctor. Thank you so much. Dr.
Thank
Frank
you.
Lavecchio again, Valley Wise Health. It's good to have you here.
Great to have you.